I'd like to tell you a little bit about today's guest speaker that we've got with us. We're very fortunate to have Dr Jemma Gilchrist with us. She's a leading psychologist and she'll talk to us about how we can help tackle our fears of cancer returning and how we can look forward to the future. Dr Jemma Gilchrist is a senior clinical psychologist who specialises in psycho-oncology. Jemma completed her PhD at Otago University in New Zealand in 1995, and she's worked in tertiary oncology services providing psychosocial care to adults with a wide range of cancer diagnoses as well as their families and carers. Jemma works in Sydney at the Crown Princess Mary Cancer Centre, Westmead, and in private practice as well. She has experience in educating other health professionals on psychosocial support and interventions in the oncology setting. She has a long-standing interest in the impact and treatment of anxiety in the medically unwell and is currently involved in research on the psychological treatment of severe fear of cancer recurrence. Jemma has also co-edited a book for health professionals called Psychosocial Care of Cancer Patients, a health professional's guide to what to say and do. So it's with great pleasure that I invite Dr Jemma Gilchrist here for Cancer Update 2012. Please join me in welcoming her.
Hello everybody, I'm really delighted and humbled to be asked to come and speak with you. What I'm hoping to do today is to share some of the ideas and strategies that I think people that I speak to, cancer patients and their families, find helpful. And so it's really going to be a mixture of things, and not everything is going to be helpful for everybody in the room, and so you'll need to pick those things that you think, yeah, that rings a bell with me. I think I could. I think that might be useful. I think I could take that message away with me. Okay. So really what we're talking about is that phase of survivorship. So survivorship is the part. I'm just going to move this down, being height challenged, so you can hear me. It comes at the end of where the intense cancer treatment is finished, and people often feel as if they've got through the cancer treatment and that's wonderful, and what happens now? And so a lot of people feel that they're searching for meaning in what they faced, and lots of things feel different, and lots of people don't expect them to feel different. And your mind and your body and your spirit might feel all shook up, and your perspectives on life might have changed. And the value you place on things, whether that's relationships or work or material things, they might be very different than before. And people often talk about before I had the cancer and after they had the cancer, even 20, 30 years after a diagnosis. It's kind of BC. So people expect you to get back to normal, whatever that is, and most people think that life is normal, is anything but normal. And a big part of that is this enduring fear that the cancer might come back, which I'm going to call fear of cancer recurrence. So there's lots of challenges in the survivorship stage, which I do want to touch on because they're really important as well. And what we know is from the research literature that the distress that people feel at the end of treatment, interestingly enough, is the same as they feel at the beginning of treatment, which is a big surprise, actually, to people when they start this journey. And largely that's because people expect to feel, relieved and triumphant and bulletproof and grateful, and instead, many people feel anxious and resentful and traumatised and fatigued and lonely and patronised, and sometimes let down by a system which in the beginning promised so much support and gave a lot of support, and then at this stage it all kind of seems to filter through and peter away. And then there's even that word survivor, and that word survivor really sort of suggests there was an epic battle, and the only way you can get past this epic battle is to have, survived in ultimate triumph. And it's not the way that everybody feels. Often it's, yes, a sense of huge relief, but not necessarily with triumph, because there's a whole lot of baggage that came with the experience. And I'll just have to read some of these slides. So this is the slide at the bottom says, I heard this was the scariest part of the ride. So lots of people say, I don't feel triumphant, I actually feel scared. And fear of recurrence happens for most people. Almost everybody I see clinically is frightened on some level that the cancer that will come back. And the ones that aren't, I think, from Macbeth, the lady doth protest too much, I think sometimes they really are deep down, but they're frightened to actually say it. People, though, they vary hugely in how fearful they are of the cancer coming back. What we do know is that it's severe, actually, and around 50% of cancer survivors. So 1 in 2 of everybody that finishes their treatment are going to be pretty hamstrung by the fear. For most people, the intensity varies, though. Okay, so what I often say to people is that it can start like this, the emotional journey, and then the bumps become not quite so severe over time, and there's less between them, but you're still going to get a bumpy ride. And sometimes the bumps can happen a long, long way after the cancer diagnosis. So people say it is a roller coaster, and it certainly is, but it's not all that predictable about what your personal roller coaster is going to be like. What we do know usually is that fear of cancer recurrence gets less over time for most people. So what do people tell us that they feel? Well, here's some of the things that people tell us they feel. They feel petrified by physical symptoms. You know, what's that lump? What's that bump? Why is my jaw aching? Why does my leg suddenly ache? My hip's not good. What's the matter? They feel worried or anxious or panicky or on edge. And people who may never have had a history of panic attacks can sometimes develop them completely out of the blue. People can feel angry and irritable. So not everyone, as I said before, is happy and relieved. They feel angry about what this experience might have taken away from their life, or angry about the way other people are viewing them now. So people when you get angry, you get sad or depressed. You know, some people as well, they feel anxious, and that anxiety, particularly for men actually, can masquerade as anger. So just to explain that a little better, what I suppose I'm saying is that many men who feel uptight and nervy and jittery about this coming back won't necessarily recognise that's the way they feel. What will come out is anger and sarcasm or irritability. People can feel exhausted and sleep poorly, and we all know how rational and together we are after a really bad night's sleep. So sleeping poorly makes things a lot worse. People feel frustrated and misunderstood by other people, and sometimes that can really mean that you have trouble being close and trouble being intimate with other people. Some people, severe recurrence means that you avoid things, you avoid decisions, people, work, friends. You lack confidence in yourself. You lack confidence in your body or in medicine or your doctors, and then it can make you feel isolated and alone. Now, I suppose today, because I'm focusing on the fear of cancer recurrence and what to do about it, I'm not focusing on many of the helpful and uplifting things that the cancer experience can bring. I'm going to touch on some of those things, but I'm not meaning to imply that everything that happens is doom or gloom. It's just because I'm focusing on the fear aspect in the talk. So fear doesn't come in equal strengths. Okay, so people think things like, it might come back, but I try not to think about, I try to think about the good stories, the ones who lived, so there'll be the people that think about the Olivia Newton-Johns and the Kylie Minogues and so on, okay. There are people that think, I get worried come scan time, but it passes, I'm okay. And then there's people at the other extreme. If I have to go to the hospital, I shake, I sweat, I get panicky, I feel like crying, I don't want to go, I can't go back there to see my doctor, I just feel sick. If ever they keep me waiting in the wait room, my stomach just churns, I have to go to the toilet all the time. Or people say, I go to my GP all the time, she must be fed up with me. We have this a situation in a practice I work in where one of the medical oncologists is married to a GP who works in a completely different area. And they often share some of the patients. And I often think, I wonder what they think, because the patient that I'll be seeing is racing off to the GP who's the wife, whose husband has been treating the patient, and there's this little loop going on. So why do people feel so scared? It's not always about being frightened of dying. That's a part of it. And I want to say that up front, but there's kind of two themes that people often say they feel frightened of. Turning to the first one, because that's the scariest one, that is, I'll die from this at some point. If not now, then maybe later. And the problem with that is it makes people feel, well, when? When's that going to happen? I just want to know. I just want to know, and then I'll be okay, So people get very worried about being carefree no more. That sense of, my body's, my friend, can be lost. People worry they're going to die like somebody else did that they saw die, somebody close to them, somebody in the media. They worry about being a burden or dependent on other people, losing their role or their function again in life, being, losing control, being a failure, or letting other people down. And I think that bottom point is particularly true, I see, in people who have young children. They're very, very worried about whether this will ruin the kids' lives if the cancer comes back and ultimately they don't survive it. But that's not all of it. The other part of it is, I don't like the look of this treatment thing, and I don't want to do that again. Thank you for the kind offer. I'd like to politely decline because it wasn't much fun the first time. And the thing is, when people go in for cancer treatment the first time, unless you've had someone close to you or go through the cancer treatment, ignorance can be bliss in the beginning. Once you've done it once, you can no longer stick your head in the sand, and you know what you're up for. And lots of people aren't keen for that all over again. And particularly that sense of life feeling hijacked and the disruption to work. And for lots of people, it's that, well, look, I did it all before and it came back, so what's the point in doing it all again? I don't get that. I'm being very frightened about the burden on relationships. And deep down, emotionally, most people don't even consider a local recurrence as a possibility. So that's the local recurrence, meaning the cancer coming back in the same place. So a prostate cancer coming back, or a breast cancer coming back in a breast. People normally fear that if there's recurrence, then there's going to be widespread disease, and there's going to be metastatic disease, and cure is no longer an option. And yes, look, of course, that's a possibility, definitely. But it's not the ultimate probability that people assume it is. Many people that I see with recurrences are local recurrences, or recurrences back in the same place that need treatment again in a similar way to the first treatment. But deep down in our psyche and deep down in what we see in communities, the idea is that, cancer's deadly. If it's not going to get you now, it'll get you later. And then people wait for the axe to fall, and that's really the root of the problem. So look at some things that triggers the fear. Okay, lots of re-triggering in the community. So, celebrity diagnoses, and I'm sure, I don't know about the Cancer Council here, I'm sure it was similar nationally, but when Kylie Minogue was diagnosed, for example, there were many, many calls to helplines and things to get information, support and advice. Pink, everything. The Pink has been wonderful for fundraising. But the reality is, and I'm not criticising that for a second because it's done some wonderful things, but when you're a cancer survivor, wandering around Coles or Woolies and seeing your pink Tim Tams and your pink batteries and your pink water bottles and your pink everything can be confronting. In the M4 in Sydney, we can drive down and there's this huge billboard of two bottles stinking out which look like two big pink nipples standing out. You can't miss it. So everywhere you go, it's all around you. And then, of course, the anniversaries and any physical sensation can trigger. The other thing that fuels the fear is the inconsistency between how cancers are followed up and by whom. And that is really true depending on which cancer type you've got, even the tumour type. So if someone's had the DCIS there, for those of you that haven't seen that before, is ductal carcinoma in situ, is a particular type of early breast cancer or pre-invasive cancer. That will be very differently treated to someone with an invasive breast cancer. But you don't necessarily realise that when you're sat in the wait room next to the woman that seems to be getting the whole deal and you don't. And it's easy to think, well, just a minute, I've obviously got the dud doctor who doesn't know what they're doing. I want that doctor who gives all the reasonable treatment. It's very nerve-wracking if you've got lots and lots of different treatment. Active surveillance for prostate cancer can be really difficult, particularly if you're in a support group with others who aren't under active surveillance, okay, and other people are getting radiotherapy or much more regular PSA checks. There's inconsistency depending on where you live, where you're treated and where you live. And Australia is obviously a very big place, and providing treatment to the population is extremely tricky, and it's different depending on whether you're metro or rural, public, private, all sorts of complexities. The other thing is that protocols change over time. I found even when you go off for an extended period of time to have children and what have you, you come back and you think, oh, hang on a minute, things have changed. There's a new chemotherapy protocol, or the follow-up for this or that or the other is different. So things have changed dramatically since I've been working in cancer care. Okay, other things fuel the fear. Okay, and we're going to get on to what you do about these things in a minute, but other people fuel the fear. Okay, and I'm sure you've met these people. So people that go, oh, but why don't they scan you more? Or, oh, it's great you're doing well, but shouldn't they have done another blood test? Or, you've got to catch it early. You've got to go to the doctor straight away when you get that hip ache, because it could be something. Because my neighbour, he did da-da-da-da-da, and then horribly, blah, 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 blah. Or they start with, oh, you're so lucky, it's great you finished your treatment, well done, because I knew of a neighbour who did da-da-da-da-da-da. So people tell you horrible stories all the time. And I often liken it to, if you've just got divorced, people don't say, woo, great, on to the next phase of your life. They'll start to say, oh, the custody battle will cost you a fortune, Or if, I find that at all sorts of stages in life. When you're just about to leave school, people say, oh, it's the best years of your life gone. You turn 21, oh, it's all downhill from here. You have your first child, oh, you wait till you have your second. It doesn't matter what you do, it's the same kind of idea. And people do it for this. When 8.5 months pregnant and people tell you their hideous birth stories, you can't get out of it. And so I think what it leads to is feeling alone in a crowd. It doesn't. So people feel that they're being told it doesn't matter that your hair is short or grey or thin or curly. You're lucky you had one baby. Be thankful. You might feel not quite so lucky if you wanted 5 babies. The treatment was a small price to pay for your life. You've cheated death. Be grateful to be alive. You've got a second chance. Change the way you eat and live and drink and stop drinking and meditate for 5 hours a day and juice everything you can find. You shouldn't stress so much. It's pretty difficult when you've got to do all that other stuff that's up the list. Just don't worry about it coming back. Why can't you put it behind you? So all that stuff leaves you feeling a bit like this. She's got some hilarious things to say on the acid, I've discovered. And fear can really disrupt medical care. Okay, so lots of people, and I won't dwell on this too much, but they'll start to avoid appointments and tests, and that's a problem because it might allow a small problem to get a lot bigger, whether it's cancer-related or not, and it means a person puts up with feeling dreadful or feeling anxious when it's something that they could have easily been relieved, actually. So a common example of that would be headaches. It's an extremely common stress-related issue that people believe is a cancer recurrence in the brain, and they will put off seeing a doctor for weeks or months for something that actually can be quite easily sorted out. Other people will overuse tests and scans, and that's one of the reasons why we are doing more research on this, because we know it's actually a very big cost to people's happiness and to the healthcare budget. People ask for lots and lots of tests and scans for all sorts of insignificant things, which are then found out to be all sorts of other things, which often are benign or not a problem, but have put the person and the system through a tremendous amount of emotional and financial cost. And the thing is, it maintains the fear as well. The more times you go to the doctor and get things checked out, the more nervous you get often. Okay. And the problem is, we as healthcare professionals don't really know a lot about fear of cancer recurrence, or FCR as I've put it there. So we don't prevent it, we don't educate ourselves and others very well about it, we don't particularly coordinate care very well, and we don't talk to people about strategies to cope. So that's where I'm going to turn to a lot more now. So now I want to talk about putting it all back together. Now I know that's a bit of and it took me a long time to search for that cheesy diagram on the internet, but it really, I chose a heart deliberately because a lot of people will tell me they feel like their heart is quite literally broken. They feel like they're all in bits. So how you start to put it back together, the first thing you need to think about is your own experience. Okay, and this is what I mean about there is no one correct answer. It's going to be different strokes for different folks, for all of you in here. You've got to think about, if you're here as a supporter to someone else, think about the person that you love or care about, and think about these questions for them. How were they diagnosed? You know, there is a big difference between managing fear for someone who had a routine screen, who had a very early cancer. Let's take breast cancer, for example, had a very early cancer picked up. They had routine surgery, their treatment went according to plan, and they had a good outcome and they coped. That person is very different from the person who knew there was something wrong, could feel a lump. It wouldn't. They go to the doctor said it was a blocked milk duct, come back in a couple of months at the end of breastfeeding, then life got busy, then they didn't, then they came and went, then eventually they went for a mammogram and then they couldn't find it, and then 6 months later they go back and there it is, and then suddenly we've got a delayed diagnosis on our hands. So for that person, lots of fear, lots of mistrust, lots of crankiness and anger at their body where they need to actually spend quite a bit of time. So it depends how you were diagnosed. Depends on the kinds of experiences you've had with cancer in yourself and the people close to you. Are you a carer? Are you a carer for other people? How's it going to land in your life? So getting the cancer back or being frightened of it coming back is often about being frightened of how that particular ripple is going to hit in the pond for everybody. Okay. It also depends if you've got other stuff going on. And we often, and I was reading a New Yorker cartoon which I loved, and that said that, psychologists don't charge you extra for emotional baggage. So it's not like you turn up to us and we go, you've got one piece of emotional baggage for free and every other piece of emotional baggage is going to cost you $50 before you can come into the session. It's not like boarding an aircraft. So other people come with lots of emotional baggage. Cancer doesn't hit in a vacuum, and you sometimes need help for other things because you can deal with recurrence. So if you're really a Vietnam vet and you've got post-traumatic stress disorder or a major alcohol problem, for example, if you've always struggled with substances, you've got a history of panic, you've got to do something about those things before you can realistically get on top of this particular fear. So when we think about getting on top of the fear, we think about it in the vicious cycle. So looking at this particular cycle, where you might start with a headache, and your first thought is, it's a brain tumour. I knew it. If it's back, I know it's back. I know it. I'm going to die. And then anxiety, sadness, fast-beating heart, dizziness, difficulty breathing, agitation, not feeling right, not being able to catch your thoughts properly, lots of calls to the doctor, wanting an immediate scan, irritability, increasing your drinking because you just can't face it, all of which finishes up with a headache again. So when we think about getting started, you can start anywhere you like in the cycle that suits you, but you've got to break that vicious cycle somewhere. So this one says at the bottom, hello, we're encouraging people to come involved in their own rescue these days. And that's the reality of it, because the services often aren't as thick on the ground after treatment. So that's why you've got to be nousy about what you think will help you. So first off, get information and make a plan. Ask what you can do to reduce recurrence for your particular situation. So understand the surveillance you need and why you need it. And that is not the same as the person in the support group or the person sitting next to you in the waiting room or Auntie Dot who had cancer treatment 10 years ago. It's not the same as what they need. Go to the horse's mouth, the doctor's treating team, and find out what you need from whom and from when, in what time frame. And most of you will have discovered by now this is not an easy task. I've made it sound easy. It's not easy. But nevertheless, you've got to be like a dog with a bone and try and find out this information. For your particular cancer, know what symptoms to look out for. Because most cancers have some level of prediction, or some level of pattern, I should say, about where they recur, if they recur. Okay? So a prostate cancer does not usually recur in your ankle bone. So if you've got a stiff ankle and you're avoiding going to the doctor, it's probably not your prostate cancer returning. And I know that sounds silly, but that's the kind of stuff that we see all the time. People quite honestly thinking that cancer's returned in their big toe. Okay? Or they start to get osteoarthritis or something like that, and they put up with pain and discomfort, and it's a symptom nothing to do with cancer. So know if you've got to look out for breathlessness or pain or dizziness or urination changes, bowel changes, blood in stool, whatever it is, find out what you need to look out for and who you go to. Now, something called a survivorship care plan is a useful idea. And I've got some of you might be interested to come and have a chat with me afterwards and have a look at them. Survivorship care plans are useful. They're not used routinely here. They're used more in the US and the UK, actually. But I actually think they're a terrific idea, and we're starting to look at them more. Basically, this one's from a place called Journey Forward, journeyforward.org, and this is from this one's from the National Cancer Institute. And we've got others from Peter McCallum in this National Survivorship Centre in Melbourne. So come and have a look in a minute. But basically, what they do is they summarise things like this. And I won't read them all out, but there are things like the records of treatments that you actually had. So, what treatment, what tests you had, what diagnosis you got, so grading, staging, nodes, pathology, the treatment type, the doses, who your treating team was, who you should contact. Very tricky, particularly in big metro hospitals. So who's that care coordinator from now on? It also has follow-up care plans, what to do, what screening you should have, when, who you should see, when, what schedule of testing you need. It has information about known preventers like tamoxifen, for example, or things you can do generally to help, vitamin D, caltrate, those sorts of things. It has information on late side effects, psychosocial support that you can get. If you need genetic counselling or your family might benefit from that, other health professionals, physios, OTs, people like that can help, people to help with lymphedema, for example, and other healthy behaviours that you can do. Okay, so they're a good idea, so have a look if you're interested. The second thing is, if you know you're a checker and you check too much and it drives you bonkers, work out a plan with your doctor if you realise that fear is excessive to do something about it. It takes time to trust your body again. Lots of people feel, we have to spend all our days in our bodies. We actually don't have a lot of choice in that. So it's pretty difficult if you don't like it much and you don't get on and you treat it like a recalcitrant cousin that you can't be bothered dealing with. You and it have to actually kind of be friends. And that takes time. And you have to make an effort not to second-guess it constantly. A lot of people feel as if their body let them down. Okay, and some people feel as if they let their bodies down by some of the behaviours and lifestyles that they chose. So make an effort not to check unnecessarily if you can, because it just maintains that am I sick yet fear. Now, I'm going to be really mean and ask, if I said something really mean like, does anyone need to go to the toilet in here? Everyone will go, oh, do I? I don't know. Now she said that, I wonder if I can wait. Because the minute I do it, what happens is you plant that fear. And psychologically, it just whines and whines and whines. And that's what it does. If I tell you all not to think of pink elephants, whatever you do, don't think of pink elephants, and particularly don't think of a pink elephant with a blue nose. There we go. So it's the way our minds work. So you've actually got to stop yourself doing some of that stuff. Okay. Be open to others about how you feel. Don't try and hide it. Don't let fear stop you getting information, and that might mean you've got to ask the hard stuff, which is, what do I do if the cancer comes back? Okay, if you can't find, a doctor in your medical team you trust, find your GP or someone else, and you might need to be more assertive and ask for information, and you might need to be realistic. There is no certainty, full stop. There really isn't. Your doctor doesn't have a crystal ball. They can't reassure you completely. They can't be very specific. But there are lots of times in life we're not told what we want to hear. We don't know if this is the good job we should have taken. We don't know if we've married the right person. We don't know if we should move to a different country. We don't know if we've chosen the right... We don't know a lot of things in our lives. But we do our best. And this is no different. There's lots of uncertainty in life generally. Okay. Take some control with others in your communication as well. So, about the horror stories, I just want to stop you there. I only listen to stories with happy endings, just in case you're going to say something hideous, You don't owe people information, so if they're too intrusive, or they ask you too many probing questions, or a new person who's diagnosed is leaning on you too much, it's okay. You can say, back off for a bit, or you can try and help them find other supports. All right. Nurturing your body, that's really important. There's lots and lots and lots of ways to nurture your body, but whatever you choose to do it with self-respect. Don't do it with guilt and fear. None of us really respond well to the fact that we really should drink less because it's good for us. We drink less if we want to because it nurtures our body. We eat food because it gives us nutrition. So have that focus. I pinched this Youre diamond from... I think from Petrea King, actually, who's got some really uplifting things to say. And she said, you're a diamond, cut some bits and polish others. I thought that was a great way of looking at things. So, think about things you can actually do to help yourself. And so some of these I've mentioned already, but I do like the idea of do everything in moderation, including moderation from time to time. But don't tolerate the things you do that aren't good for you. Things like nutrition, please get the information. And when you... Don't just follow diets blithely with no background, because when you're looking at surviving cancer and going on with your life, you've also got to look beyond cancer. You know, we need to look at preventing other things, cardiovascular disease, type 2 diabetes, other things we're at risk of. So you actually need to look broadly and do the things that help you live well for all sorts of other illnesses. The other thing is when cancer changes the way people view their lives. You know, you might not be on the same page as other people anymore. You might be reading a totally different book. Your roles might have changed, and then lots of emotions that you might have had in the beginning that were shelved came back. So lots of things you weren't certain about, relationship issues, problems with work, you know, they've come back, and your mind and your body and your spirit might feel completely exhausted. And it's okay to grieve those losses. It's all right to give yourself time, and then it's also okay to sort of fluff those emotional pillows. So sometimes you might feel like the very bottom frog and not the very top frog. All right, time for your thoughts and feelings. Okay, so this says at the bottom, none of us really get to our deathbeds and go, I should have bought more crap. So our perspectives do change, you know, but sometimes we do need a shake-up to think about life. Okay, it can even bring a new crisis. She says here, now I think of it, I think I'd look better without you. I've had a lot of people over the years that really think about whether this relationship or job or lifestyle or whatever is for them. Okay. So that brings me naturally to talking a bit about stress and cancer. There's a lot of controversy about stress and cancer. People ask me all the time, and they drag their loved ones in to get me to tell them to stress less. Okay? And really, what the research shows, which is contrary to what we believe, is there is no evidence that stress causes cancer. No evidence it directly causes cancer. There is evidence it causes other behaviours like increase in smoking and drinking and poor diets and low exercise and things, and they can indirectly increase your risk of cancer. But when you look at the psychological evidence for positivity and low stress, nothing. And that comes as a big surprise, I think, to many people. And look, it is not for want of trying. You go to any psychological conference, it is packed with research over the years that looked at whether stress influences cancer. Now, we might find in years to come that we haven't been measuring it properly, we haven't been asking the right questions, whatever. What we do know is if there is a relationship, it's not a simple one, and it's not as simple as it's portrayed in the community. What we do know about stress is it can cause other health problems. It does make us unhappy. It's revolting to live with, and we can do something about it. So we may as well. So absolutely, I'm putting my hand up for stress management completely, but not because it'll stop the cancer coming back, but because it's worthy and we should do it because it'll make us feel better. The other thing is stress can lead to panic attacks and lots of really, really strong physical symptoms. So in the same way I was going on before about the way focusing our thoughts on a physical symptom can escalate it, panic symptoms and anxiety can escalate most physical symptoms. They can escalate things like breathlessness, bowel disturbance, dizziness, gut disturbances, muscle tension, headaches, all sorts of things. Okay? And panic symptoms can trick you that you're really, really physically sick. And it doesn't mean that the symptoms are all in your head. They're not. They're extremely physically real because the results of the stress and the way it affects you hormonally produces the same symptom in your body. So it's not that it's all in your head, but what's going on in your head is making a big difference to your body. And sometimes with all this, people say they feel like throwing in the towel. All right, so what I often say about stress is it's the imbalance between all the things that load on top of you on the left-hand side of that diagram and the other things that you do to nurture yourself. For most people in modern life, even before they started the cancer journey, there's a big pile-up of stuff on that side, okay, a big pile-up, okay. So that's where the cancer goes, boom, right in the middle of your life, okay. And we don't do enough on the other side. So think small first. She says, I'm not asking you to change your spots, I'm just asking you to take out the rubbish. So sometimes we need to ask for the stuff that we need. If you go back to that, you think about what's on either side of that diagram for you. What's the small stuff? Because it doesn't matter if the boxes are big or small, they all add up at the end of the day. Lots of the small things like taking out the rubbish and who doesn't change the toilet roll and, whatever, they all add up. once you've thought small and think about the small changes you can make in life, the little stuff, think big. So it's really important when you go through this experience to think about what matters in your life. Okay? One of the things I will say is people often try to be extremely virtuous, and to all those lifestyle changes that are complete perfection. And I always say to the people that I see, there is absolutely no point in surviving cancer and then boring yourself to death instead. You really need to live your life, and you really need to live a life that matters to you, that's fun and engaging and connects you with others and makes the whole ride worthwhile, however long it's going to be. So do a bit of a stock take, okay? How am I the same? How am I different? What do you value? So values are like guiding lights. You don't actually reach them. So I might have a guiding light in myself as I want to be a nurturing and loving mum. You know, I want to be a caring and committed psychologist. Hopefully it's not that I get that one day and go, oh, that's all my nurturing and caring done, stuff it, I'm off. It's that's my guiding light for the rest of my life. And so we all have guiding lights. We all have things that matter to us, that we value. Whether it's connecting to the community, whether it's engaging in craft, whether it's spending time with people that we love, whether it's spending more time with God, whether it's spending time in pursuits or leisure, whatever it is. Think about what matters. Be the partner or daughter or mum or son that you want to be. So rather than thinking about balance, going back to the other slide, we always talk about balance, get balance in life. Think about imbalance. Think about tipping it this way a bit. Okay, do the stuff that really matters, because the other stuff will always be there on the other side. Okay, so sway towards what gives life pleasure. I often get people to do this little exercise, which you can do when you get home, and that's really about thinking about your life as a dartboard, divided up into relationships and spirituality and work and occupation and finances, and think about where you throw the dart. If the dart's in the bullseye, you're living the life the way you want to. If it's on the outside, you're very far away from what matters. So if you're far away from what matters, make some goals to get closer to the bullseye. Goals matter. You've done this before. It's not the first time you've managed uncertainty. People have, they've got divorced, they've got married, they've had kids, they've changed jobs, they've lost businesses, won businesses, done all sorts of things. Okay? Think about what strengths you've got. Think about what you're thankful for. What have you learnt? What's worked before? Who will support you? What brings you joy? And when you think about that, think about how you direct your energy. Think about what saps your energy, and think about what gives you energy. The energy sappers and drainers and the energy builders. And go for the energy builders. We all have to do some energy sappers, but life's going to chuck them our way anyway. Okay. Right, mind your thinking. That's really important. Any new challenge, living a valued life, that's not easy. That involves a lot of a shake-up for lots of us. Okay? And we all are going to get irrational, catastrophic, unhelpful thoughts. And I won't go through all of those, but they're things like, I'll never have another relationship. No one will ever fancy me again. There's nothing I can do now. There's no point in stopping smoking. What's the point? She's just telling me it doesn't matter, the fact I can't get an erection, but it does matter. It matters to me. Okay? I was always the strong one. Now look at me. Lots of thoughts that bombard us. And often, it's the hardest thing we have to conquer is actually ourselves. So try being less black and white about things. Try being your friend, speaking to yourself calmly. Try believing that you're actually not the 1% for a change, rather than thinking, yeah, I know, but I'm always going to be the 1%. You don't think that when you buy a lotto ticket, do you? You don't walk in there going, I know I'm going to be this 1%. I know I'm going to be the winner. Understand that you can't read minds or the future, and just because you want to be happy doesn't mean you're going to jinx happiness. You're not going to tempt fate by being smug and happy. Ditch the generalisations and conclusions and pessimism, because they don't bring you much. And remember, if you're constantly jailing yourself behind this fear, if you hold your fear like this constantly, it's very difficult to do stuff that matters if it's like this. You don't have to make it do this, so it's not part of your life. But you can put it here. You can put it here. So you don't have to be either or. Get rid of it, to be okay. You don't have to get rid of your fear. You just got to make it a little bit more manageable so you can do enough. So I often say, be the boss of worry. And I use this thing called a worry time. You know, postpone a worry until that time. I know it sounds like a crazy idea, but it actually works. So you make yourself a jolly good worry time between 4 and 4:15. And then you have a jolly good worry between 4:15. And you write it all down. I know it sounds bonkers, but it actually really works. And then whenever the worries pop up at other times, you go, no, not doing that. I'm going to have a jolly good worry at 4:15. We actually do this all day. When I get into work and I have that, oh, God, I didn't get the chicken out of the freezer, that thought, then I actually think, well, there's nothing I can do now because I'm working all day, so I will actually worry about that when I get into the car park. And then I'll worry about the chicken situation. So we can do that, and you can do it with this as well. Okay? So you've got two choices. You can challenge your thinking, but another choice is you can unstick it. So if you know there are some thoughts that just keep on coming back, you know, they just repeat and repeat and repeat, well, stop wrestling with them. Think of them like a pig in mud. You both get dirty and the pig likes it and it comes back for more. So often our emotional pain is caused because we struggle. We struggle all the time with trying to feel a different way. We're trying to be less pessimistic or more happy or more engaged or more thoughtful or less negative or whatever we're trying to do. We are what we are. And struggling often doesn't help. So thoughts are just thoughts and they're a normal part of life. And then just think, you know, just staring at your bald head or your flabby thighs or wishing you were younger or thinner or cleverer or healthier or richer, if you did that again and again and again, how many times has that helped you feel happier and more engaged in your life and at one and peace with the world? No, it doesn't make your hair grow, brain develop, stop cancer, win lotto and melt fat just because you thought of it. A thought is just a thought. I can think, whoa, it's going to have a crisis. Whoa. Can we stop that? Plug it in so it doesn't have a crisis. So I think the thing is that thoughts are just thoughts. We don't have to listen to everything that our brain tells us because when we do, it just kind of gets exhausting. Oops, I can't go on for a minute. Sorry. I often say, I'll just talk around that point actually for a second. I often say it's a bit like a tug of war. If you imagine a tug of war, there are two ways to win the fight. One way is to tug and tug and tug and tug and tug with your thoughts as hard as you possibly can until they fall over and you're the ultimate survivor. Or you just go, fine, you're there, I know you're there, and you just drop the rope. When you're playing tug of war, that's another way to actually win the tug of war. You don't have to pull as hard as you can. Okay. So play with your thoughts. They're created by you. Try unsticking them. So I often play thought games. This is called diffusion with patients, with the people that I work with. And we call it unsticking your thoughts, just learning ways to notice them. So imagine them as unhooking them and letting them swim. Imagine them as champagne bubbles popping up. Okay. I often do, when I know people well, get their scariest thoughts right out there. You know, the scariest thoughts, I'm going to die. And we sing I'm going to die to Happy Birthday. And it sounds crazy. But once you've sung it over and over, it sounds stupid. And you actually realise they're just words. That's all they are. So if you can be brave, try it with some of your scary thoughts later on, see what happens. Okay. So shouldn't I just be positive? Or something people say, or just be positive, you know. But actually it makes people who've had cancer really cranky, usually. And it adds pressure, and there's absolutely no evidence that it helps survival. None. Same as stress. Okay. We know, though, being realistic but optimistic helps. It helps people comply with treatments while they're in cancer treatment. It helps people stay well after it. So don't judge if you're a carer. You telling them to think positive is just going to make them really annoyed, usually, not make them think positive. I love this one. I decided to return all the expectations people had given me. The other thing you can do is have a settled mind, okay? And so that helps with the mind struggle. And the concept of mindfulness is regularly out there. And you can search this on your search engine, have a bit of a look. There's lots of scripts, there's lots of CDs and things you can get from the Cancer Council. It's useful. It's a particular technique, and there's all sorts of ways of learning it, but it's a meditation technique that allows you to have a quiet mind. The particular one I love is really immersing yourself in the detail of life and noticing. So, for example, next time you have a shower, Rather than sort of, thinking, I've got to get to work and scrubbing and doing all this and getting out the door, then actually stop. Watch the bubbles. Smell the soap. Think about how it feels on your skin. Think about where the water's falling and what that feels like. Just notice. The next time someone you love gives you a cuddle, breathe it in. Feel where that is on your body. Take a moment. Notice how lucky you are to have someone that thinks you are the bee's knees in their life. So look at a view. Look at something. Okay, look at a tree. Even the rain yesterday, and that was interesting, in Fremantle, in Perth for the first time. You could look out the window, and it's fascinating actually watching that come over the coast. Just whatever you're doing, just stop and notice. All the time our minds are racing forward to the next thing that's coming, or they're racing back to all the stuff that's gone before. And mindfulness helps you just stop and breathe and take a moment. So it really drops an anchor. That's what it does. It helps you drop an anchor and just be still for a moment. The other thing, importantly, of course, don't go it alone. Reach out and laugh with other people where you can, whether it's support groups or friends or whatever. And if you're a support person, please try not to say these kinds of things because it's really irritating. Just be positive, or I know how you feel, or we're all going to die, or you could get knocked over by a bus, or I know you'll be okay. No, you don't. Well, stop worrying about it. If they would, they could, wouldn't they? So those things are generally seen to be fairly unhelpful. Okay, don't push particular beliefs, whatever they are, whether it's juicing or God or how many times you're supposed to meditate per day or, African acacia beans or whatever it is. Don't give advice. Don't ask probing and personal questions they clearly don't want to answer. Don't make blunt observations like, you've lost weight. To someone who's nervous about their bowel habit and thinks that losing weight is a sign of recurrence, they go, have I? This is not a compliment to them. They worry. So blunt observations with someone you don't know, not always that helpful. And don't draw comparisons with others. Just like, we don't care how somebody else went through their divorce or how somebody else had their baby or whether somebody else lost their job and we've just lost it. We don't really care about that. We care about us, usually. So leave those things for a while. And if you're going to draw comparisons and try and be helpful, be sensitive with that. So there's a lot of difference between doing this and doing this. All right. Professional help. I might go through this fairly quickly because I do want to make time for questions. If you need more help, these are some of the things that can indicate that. And I won't go through them all, but if you're finding that you've got distress that's not doing that, it's doing that and staying, get help. If you've got past emotional problems that are getting worse, substance issues, if you're avoiding, if you've got lots of physical symptoms that the doctors are saying, look, I think these are stress-related, do something about them because you can feel better. If others tell you you're not the same, you're moody, you're unhappy, you're lost, you're frightened, you're lonely, if you think you're not coping, if you want to take the opportunity to look at how to live life now, a lot of what I do is not about doom or gloom, and that's why I love my job. A lot of what I do is helping people live life well now. How do you make the most of it? How do you grow? How do you learn? How do you nurture? How do you have a laugh? How do you embrace your life? That's the good stuff. So seeing a psychologist is not all about dragging through your past and doing all that sort of stuff. We actually do very little about that. Very forward-focused. There's lots of things like GP mental health plans as well available. So a couple of take-home messages. Reach out and talk. Get information. Balance common sense vigilance about your body with health anxiety. Invest in your lifestyle because you're worth it. Live a valued life because it matters. Get that seesaw thing balanced. Mind your thinking. And let the moments count because we all can. And I chose to kind of summarise this, and it may seem a bit cheesy, but I thought, this kind of summarises what I wanted to say. And that's really just to have this courage to shine. It's okay to shine. So get a care plan and control. Open up. Understand your risk factors and reach out. Acknowledge fear is difficult and it's part of it and it's normal and it'll get better. Make goals and expectations. Remember, your thoughts are just your thoughts. This is an opportunity for change, so grab it. Manage your stress. Have fun. Invest in what matters and nurture your body. And most of all, enjoy the moments because that's what we've all got and that's what life is really. And it makes it count. And I'll finish up there.
Have a drink while we talk about the questions. We do have our roving mic again here today, so we've got about 10 minutes, just less. So if there's any questions, Jemma can take some of those questions for you now. Just raise your hand and we'll get a mic to you as soon as possible. I feel like we're at an auction. We're about to sell something. No, anyone would like to go first with the first question? Yeah, up the back there.
With part of what you're saying, like the pink this, pink that, and all the rest of it, that's all very well for your common, so-called common cancers, but how much of it is all media related? Brain tumours, for example, they're just swept under the counter all the time with your support and a whole lot of things. So how much of everything is just media related?
I think that's really important, because the pink stuff, the pink everything, it's really hard if you don't have breast cancer, because you wander around thinking, and I see lots of people with rare head and neck cancers, for example, lots of people with melanoma, because we're a major melanoma treatment centre where I work, and they wander around thinking, but if all the money is going to breast cancer, who's looking at my cure and treatment? And it's really, people find that really, really difficult. And often I'm just going to move this down a bit, sorry about the noise. Often for the more rare cancers, it's harder as well to reconnect with people that are facing the same kind of thing. So for the larger cancers, breast, prostate cancer, colorectal to a certain extent, they've got they're larger cancers, more people involved, and better from often the organisational point of view, better managed in terms of support and information. But the smaller cancers are not, and it can be quite difficult to reach out. A lot of and I haven't touched on kids and teenage cancers today, I've focused on adults, but that can be the same kind of thing. And what a lot of people will find now is reaching out online is really valuable. And even if you don't have a computer at home, to go to local libraries, and a lot of the local libraries, I presume they do here, I don't know if... they certainly do in New South Wales, is they have a cancer council, kind of in small areas and places with the pamphlets and all that sort of stuff, and someone that can help you search some of the key sites for this sort of stuff. So pancreatic cancer, lung cancer, there's a lot of people with lung cancer, but because the intensity of support, because the intensity of treatment and the burden of the symptoms, it's difficult to often get the support that you need. So reaching out online is good, and really... Look, it's tricky for me because I'm not from WA, but the Cancer Council, when you see the helpline, they're a really good place to go, because they've got the networks usually, and if they don't know them offhand, they can find out. So that, I think that does make a difference. Did that answer your questions? That's sort of way. Kind of. Ask more. Yeah. Right. And it's like everything else seems to be washed away. Yeah, look, I think that's partly true. And I'm not sure what we can do about that, actually. I think some people, we know when there's a celebrity, and we've just had a recent one in New South Wales, gets a brain tumour, or and we had a recent rugby player, then it all came onto the media. But... Look, I think it can be isolating. I have a friend actually who's being treated for a brain tumour at the moment, who's struggling with fear of recurrence. He's only 2 years out, and completely missed out on support and information because he's a big burly bloke and he didn't ask for it, and also because it was really difficult to find it when he was ready, because he was 2 years down the track. And he didn't know who to ask, and he felt embarrassed and shy to ask, and his GP really didn't know, where do you find these people? And that's why, if you want support and help, talking to your GP can make a difference. Or if you think you don't have a GP who knows enough about the system, then talking to the Cancer Council, because, like I say, they do have those links, because nothing can really protect you from the fact that that you're not part of the media, but it's about the meaning of that. Why does, not being on the radar make a difference? Is it because it makes you nervous, or does it make you feel insignificant? What is it about that? And I think that's the thing to get the help in. There's one down the front, I think.
One right down the front.
how do you get help for the side effects from the radiation and chemo down the track?
Down the late side effects?
Yeah.
Yeah. Look, that it really depends on what the side effects are. It's always a good, depending on where you're treated, it's always a good start, at least, to go back to the people that treated you. I think one of the just actually before I get to the difficulties, one of the benefits of doing that is because they, if there's something that can be helped, lymphedema, for example, chronic pain, erectile problems, chronic fatigue, they can usually intervene or know someone that can help you with that. Okay. What you do have to do is you've got to be assertive, because it depends who you've got and it depends who's your treating team. Because sometimes, and I've certainly seen doctors in this situation who do feel defensive or feel as if somehow the treatment itself has been criticised or that they've caused harm or hurt by giving these treatments. And a lot of people would say, no, look, if I had all my time again, I probably would still have the treatment, because the other option I didn't want either. I didn't want for the disease to progress and to ultimately die from cancer without treatment. But I didn't expect this either. So it's not a criticism, but nevertheless I need help with it. I need to do something about it. So I'd say go back to the treating team and the allied health team at your hospital, because it's often people like occupational therapists or physiotherapists or lymphedema specialists that will help with chronic pain and other issues. So ask to speak to some of those people often, or ask to speak to one of the psychologists or the social workers, because that's a big part of our job, saying to people, what's the concerns, what is it? And it's not necessarily an emotional problem. The reason they feel so depressed and miserable is because they've got chronic pain. So then we say, okay, you need a consult for that. You actually need proper pain management. You need to see, a chronic pain team or see someone in the community or whatever. So what I would say is be assertive. Keep banging on about it if you don't think it's being taken seriously. But be realistic, because some later side effects you can relieve, but some you're stuck with, to be honest. And it's that struggle again. How much do you keep on struggling to be normal, and how much you just go, you know what? This is what I've got to work with it now. It's not what I wanted, but I've got to work with it now. But at least do everything you can to relieve it first. And be like a dog with a bone. Just keep asking.
Thank you.
Okay, I've got one last one. Thank you.
How do you help your children, when you've got young children,
Yeah.
cope with the fear that cancer is going to recur?
Yeah. Look, my thing always with young kids, well, not my thing, but the evidence as well, and my thing, is to always be honest. We spend a lot of time telling children, this is taking away from cancer for a moment, we spend a lot of time telling children, be honest. If something's happening that you don't like, you tell us. Even if we don't think we can help, or if it makes us really angry or upset, we'll still try and help you. It's really important to trust us, blah, 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 blah. And the minute we get cancer or something else, we tell them nothing, we clam up, we hide, we lie. We do all that stuff to completely undermine your own argument. So it's actually a really useful thing in families to be able to be honest about it, and same for fear of recurrence. Kids are actually quite resilient with uncertainty. You think about the life of a child, there's a lot of uncertainty coming, and they just kind of go with that. So just being honest about, look, I've done everything I can do to keep the cancer at bay. Done everything I can to do my treatment. The doctor's happy with the way that things are going. There's never a guarantee that it won't come back, but if it does come back, I'll tell you. I promise I'll tell you, and we'll do what we can to do something about it. So the real honesty, but also, be brave. And I've seen lots of situations where someone might be treated for a head and neck cancer, for example, and they continue to drink heavily and they continue to smoke. Now that is not easy for a child to witness that. Because any child that's got any cancer knowledge, and that's pretty much any child above 3 now, they will know smoking's not a good idea. And they feel as if they can often feel as if that parent is choosing to leave them by their actions. So, and I know that's a harsh thing to say, but I think too, you've got to be strong about it, be brave. And if your child is frightened, it's actually, sometimes you've got to look inward and go, yeah, maybe they've got something to be frightened about, and I should actually listen to that, rather than choose to ignore it because it suits me. So be honest and be gentle, I suppose I'd say.
We're going to have to leave the questions now. Sorry to do that. We'll have to leave the questions now, but Jemma will be here for a few more moments, and I'm sure we'll be happy to answer some questions.